So February, as we know, is American Heart Month, and March, did you know, is National Kidney Month. And new research shows that the problems in one another can quietly affect each other. This morning, to talk more about how your kidneys and your heart are deeply linked, is Dr. Samir Parikh, president of the American Society of Nephrology. Dr. Parikh, thank you for your time. Great to see you, sir.
Dan, thank you for having me on. This is such an important topic. Pleasure to be here.
Oh, well, thank you. It's great having you. You know, a lot of people think about your heart, your kidney, two separate things here. Let's just dive in big picture. How are they connected?
Well, listen, I'll share with you the way I learned about it in medical school, right? You've got the heart is your pump and the kidneys are the filter, right? The kidney's job is to filter that blood. And if the filter's not working, that's going to put a lot of strain on the heart. It's going to make that pump have to work harder. The kidneys are responsible for balancing the chemistry around the body, so that affects the electricity around the heart, so you can get abnormal electrical rhythms too. And if your kidneys are not working well, you've got one more problem, which is that the arteries around the heart start hardening. And so kidneys, when they're not working well, put a lot of stress and strain on the heart.
And if they're not working well, is that what leads to kidney disease or vice versa? I mean, I was surprised to see about 1 in 7 adults have it, and many may not even realize it, right?
Yeah, that's right. I mean, so we're talking about a silent epidemic, right? 1 in 7 adults in the United States. And look, in your market in Atlanta, it's probably even higher. And why is that? You know, what's happening? Why is there so much kidney disease out there? How come so many people's kidneys aren't working well? You know, the risk factors are diabetes, high blood pressure, cardiovascular disease, obesity, overweight, a family history of kidney disease, of course. But you start thinking about those risk factors, and we've got a lot of them. I'm calling in from Dallas. We've got a lot of all of that in the South, right? So that's those are the conditions that are putting stress on on those kidney filters that we're talking about. These are basically a bunch of small blood vessels, 1 million little filters in each kidney, and they are being pounded by years and decades of high sugars and all kinds of stress, and that's what's leading to all of this chronic kidney disease.
So if I know that I may have some of those stressors in my life or fall into some of those categories that you mentioned, what should I be doing at this point? And at what age should you really start being concerned?
Look, if you've got any of those risk factors we're talking about, right, heart disease, high blood pressure, obesity, diabetes, a family history, I think it's really important to just have a conversation with your primary care doctor. Hey, I heard I should get my kidneys checked out, because the really good news is that we have simple and accurate tests. There's a blood test and there's a urine test, and they're very good at identifying kidney disease. The problem, as you noted up top, one of the other problems we have to deal with is that kidney disease can be clinically silent. As these little microscopic filters are dropping off, it's not like you're going to feel kidney pain. And so the symptoms of kidney disease don't come on until really when kidney disease is quite advanced. And we want to catch kidney disease much, much earlier.
So you start with your PCP, and then I guess you get referred to a specialist. What could that wait be like? I mean, is that something they want to expedite?
Absolutely. You know, I mean, yes, we've got a lot of chronic kidney disease in this country, but at the same time, we've got nephrologists who are really, you know, more excited than ever to start working with patients. And I think, look, if you're a patient and you find out that you've got a new medical condition, that's not a great feeling, right? At the same time, there's never been a better time to find out what your kidney health is, because we've got breakthrough medicines that can stop kidney diseases in their tracks. And so there's just never been a better time to find out about your kidney health, find out your kidney numbers, and if you need to see a specialist, go see that specialist.
All right, what about finding out about your heart? What should you be doing in that regard?
Look, if you want to protect your heart, you absolutely have to love your kidneys. The same risk factors that lead to heart disease are the same risk factors that lead to kidney disease. And the problem is that if you get kidney disease, that actually puts extra strain on your heart. So, you know, what I tell patients, first thing, just know your numbers. Know your blood pressure number. Know your diabetes number. Know your LDL cholesterol number. And if you need to, know your kidney numbers too. And then that knowledge, Dan, becomes power. That knowledge now allows you to start advocating for your own health and getting the care you need. If it turns out you don't have kidney disease, right? If it turns out your numbers or your kidney disease numbers are normal, you've got great kidney health, then keep doing the stuff that's great for your heart, because all of that stuff winds up being good for your kidneys. Active lifestyle and a balanced diet, a heart-healthy diet. Those are really good for kidney health as well.
So I'm pretty good about exercising. I know it's good for my heart health, but you're also saying that's not enough. I should probably know my kidney numbers too, in addition to living an active lifestyle.
You know, I think if you've got any of those risk factors we're talking about, and unfortunately, a lot of us have one or another, you know, whether it's family history, even if we're leading an active lifestyle, or you've been told, you know what, your blood pressure is a little high. It's worthwhile to get these simple tests. There's a blood test that looks at how well your kidneys are filtering. There's a urine test that looks at whether your filters are starting to become leaky or damaged.
Dr. Parikh, thank you so much for your time on a very important topic this morning. Anything you want to add to leave our viewers with before I go?
Look, I mean, that message of love your kidneys, pay attention to your kidney health, so important. There's a website that you can check out, your viewership can check out. It's asn-online.org. They'll see a big banner across the top that says love your kidneys. Lots of good information in there.
Dr. Parikh, you've been very generous with your time as we work through some technical difficulties. We thank you, sir, and we hope you have a nice weekend.
Dan, thank you so much. Really appreciate it. Great to be with you.
You're welcome. Come back anytime.